I'll get started. I just wanted to start off by saying thank you for inviting me and giving me the opportunity to share a little bit about our organization, Namidane County. I am the executive director there currently, and I've been in that role for a year now. So it's been really an exciting year for me. So let's go to the next slide, Jason. Just a little background around mental illness. What we know, about 1 in 5 adults will experience a mental health condition across their lifetime. Right now, about half do not seek treatment or have access to treatment. And we know from the onset of a mental health condition, it's usually about 10 years before someone engages with treatment. For more serious mental illness like schizophrenia or bipolar disorder, it's 1 in 17 folks. And then kind of newer information around mental illness is that it starts much earlier than folks believed in the past. So about 50% of the mental health conditions will have the onset by age 14 and 75% by age 24. So this is really one of the reasons, one of our key priorities at Namidane County is to advocate for early intervention, because we know the sooner we can get folks treatment and support, the better and longer recovery they will have. Next slide. What causes a mental illness? There's a variety of different things. We know there's a genetic component to it. We also know there's a greater likelihood of the onset of mental illness for folks that experience trauma. There's also environmental and lifestyle habits and biochemical. I think also too, there's the emerging field of epigenetics, which is really a combination of environmental impact triggering maybe underlying genetic conditions for folks. Next slide, Jason. So just a little bit about Namidane County. So Namidane County is actually the founding chapter of the National Alliance on Mental Illness. It started here in Madison back in 1977. It was a small group of families that had adult sons that were living with schizophrenia, and it was really during the time that we're moving away from institutional care for individuals living with severe mental illness to community-based support. And Madison, Wisconsin has really been a leader in the area of what we would consider assertive community treatment. So really keeping folks in the community and providing those wraparound services. The founders were Nancy Abraham, Bev Young, and Harriet Shetler. Currently, Nancy Abraham is still with us. She just turned 85 last year, and her son Dylan. So, yep, she's still out there advocating and keeping us on our toes. When it started, it was AMI, Alliance for the Mentally Ill, which was French for friend. But in early 1980s, they had a national conference and it turned into NAMI. And so we do a variety of things. We really provide education programming, advocacy, and support for individuals that are impacted by mental illness, including family members and loved ones. The next slide, please. So really our mission is, this is a little bit wordier, but it's just to improve the lives of people that are impacted by a mental illness. And we do that through our key pillars of education, advocacy, and support. Can go to the next one. So some of the things that we do, and I appreciate you having me come here because a lot of times I don't think folks necessarily know all the different services and supports that we provide. It's also important to understand at Namidane County, and really the framework for the NAMI model is that we rely on volunteers with lived experience to carry out all of our programming. So our office staff are only 3 individuals, but we've actually provided services to over 2,500 people in the past year. And the way that we do that is the office staff really do a lot of volunteer recruitment, and then we help out volunteers, we get them trained, we get all the things that they need to do the different activities. So we have upwards of over 85 volunteers in the Dane County area that help us carry out the different things. The main things that we do, we have a variety of different support groups, and I can talk a little bit more about those later on. We do a tremendous amount of outreach in the community and community presentations. We do a lot in our schools. We also are very involved with our faith communities, getting out, and then also local businesses to just raise awareness around mental illness and what supports are available, and then a bit around suicide prevention. Another big component of what we do, and we're contracted with the county, is something called CIT and CIP, Crisis Intervention Team Training and Crisis Intervention Partner Training. And so these trainings are directed for our law enforcement officials, that's CIT, but then CIP is really for first responders, EMT. We've had folks who work in our libraries attend. So both of these programs are really geared towards helping people better understand the different mental health conditions that exist for people's, and then also how it might manifest in an individual that they might be working with or supporting in the community, and then also building some de-escalation skills for folks, verbal de-escalation, and just how to respond in a mental health crisis. And then we also do a tremendous amount of public awareness through our major events each year. And another big piece, and a lot of my job, is to advocate for policies that will improve the lives of people impacted by mental illness. And going back to what I said before, our three key areas right now are the decriminalization of mental illness, early interventions for children and youth, and then support for caregivers and family members. So those are kind of the top areas that we've been doing advocacy on. Although with COVID-19, I would say one of the biggest areas that we've been collaborating with service providers in this area and across the state is around telehealth services. And we were moved very quickly and were able to get a waiver, emergency waiver at the state level, and then also Medicaid reimbursement for those services because we knew providers had already shifted to that platform and there was a growing need in the community. So those are the big things of what we do. We can go on to the programs. And so we have special NAMI signature programs, and they range from 4 weeks to 10 weeks. And again, they're co-facilitated by our volunteers who have been trained. So our major programs are Family to Family, which is, it was a 10-week, it's an 8-week program now for family members of adults who, I guess, caregivers or family members who are living with adults with a mental illness. Basics and Basics on Demand is a 6-week program that's geared towards family members that have newly diagnosed children or youth. Homefront is for veterans. Peer-to-peer is for individuals living with a mental health condition. And then our Family and Friends seminar is something that we have quite a few going on right now, is a 2 to 4 hour seminar. And again, that's for family members or caregivers of individuals living with a mental illness. So our basics, our Family to Family, and our Family and Friends are now all online. And if you go to our website, you can register for those classes. So we're kind of using a hybrid of people working on the material independently and then meeting every other week to meet with the facilitators and connect with the other group members, because that one of the best things that comes out of our program is that people build connections. And so that's a key piece of all of our education programs. You can go to the next slide. Another big piece, like I mentioned before, is that we run support groups on a weekly basis. So we have the bipolar depression group, women's anxiety and depression, connecting support, and family support. And something that I'm very excited about is in the fall of 2020, we're going to be piloting our youth support groups in several local schools. So we have a partnership with MMSD, so we'll have 3 schools involved there. And then we've been working with Sun Prairie as well as Mount Horeb. So this is a new program, it's new to NAMI. We're working with an affiliate out west to have it become an evidence-based approach. And so that's very exciting. And again, all of these support groups used to be in person, but they're all online. And so anybody, if you go to our website, you can sign up. We've had good results. We've added a few just because people have had more time, and we've seen a greater need for people seeking out support. So those are all still available just online. And then the next slide. Yeah, and like I said, we also do outreach in public education. Our school presentations that we're known for is Ending the Silence. And Ending the Silence is an hour-long presentation just talking about basic information about mental health conditions in children and youth and suicide prevention. We also have another one called In Our Own Voice, and that again is about an hour long, and that is an adult living with a mental health condition that shares their personal story and then goes through a brief presentation. And then also for May, which is Mental Health Awareness Month, we have designed 2 new presentations geared towards middle school students and high school students that were designed by high school students that participate in another one of our groups called Raise Your Voice, and that's an advocacy group at the high school level. So we're working with students at Madison West and Madison Memorial to put together some of their stories, and then they'll be presenting to middle school students in the summer and the fall. So we're really excited about that as well. We also have 2 big awareness events. Unfortunately, we did have to cancel our banquet for this year. We had kind of postponed it, but we're just not comfortable at this time in bringing together a large group of people in an enclosed place. So we did make the decision to cancel that, but we'll still be recognizing our award winners online and in our newsletter. And then we're still going forward with our walk, which is October 3rd of 2020. It's Sunday. And we're hopeful. Last year we had close to 900 participants. We're not thinking we'll have that many this year. And if we have to go virtual, we'll go virtual. But it's really just a time to bring people together to celebrate their loved ones, to connect with other people, and raise awareness around mental health. Last year, we had Dane County Executive Joe Parisi attend, as well as Madison Mayor Satya. So it's been great. It was a great event last year. It's also our largest fundraising event. So last year we raised close to $195,000 through the walk. So we'll continue to promote that, but that's another big event that we hold. And then, yeah, just a bit more about the crisis intervention training. This we contract with Dane County, and our contract increased this year. So really we're trying to, a couple of years back, there was a study around behavioral health in Dane County. And one of the things is that we saw is that although Madison had a lot of law enforcement trained in CIT, the rest of the county, more of the outlying law enforcement agencies, didn't have as many officers trained in CIT. So we're really trying to work with other law enforcement agencies in the county to expand the training. It's a 40-hour training, so it is a big commitment on the part of our law enforcement agencies, in particular our smaller ones. But we're really trying to work with different regions in the county to pull together folks. And then CIP is a 16-hour training, so it's 2 days. And like I said, it's really geared towards, we open it up. We're having also different smaller agencies, smaller nonprofits participate too. You know, it's really open to folks that would be working with individuals that may be living with a mental illness. So that's sort of a high level view of all the different things we do. You know, this community has been great. Like I said, there's a long legacy here for NAMI, and so I just find it to be a really big privilege to lead this organization, especially during this time when there is a greater need for behavioral health support. So that's my presentation. I don't know if folks have questions. On our webpage, our website, we do have connections to when all of our support groups are up and running. I do think one thing I did write down, and I can put it in the chat box, are just some of the crisis lines that are available, whether it's Journey Mental Health, which is the county crisis line. We also have the National Suicide Prevention, the Text Hope line, and the NAMI helpline, as well as our number. I didn't mention, but one other thing that we do at NAMI Dane County is we do have a support line. It's not a crisis line. It's open from 9 to 5. You can call in. It's 7188, and we can connect you with who might be the different providers that would be appropriate. But the crisis line for Dane County is 608-280-2600, and that's 24 hours through Journey Mental Health. The one other thing I forgot to mention that I do want to talk about, because we have another one coming up on Thursday, is for the month of May. We've been hosting town halls. Last week we did crisis care during COVID-19. This upcoming Thursday from 1 to 2 on our Facebook page, we'll be hosting a webinar around children and youth mental health during COVID-19. So we have folks from Catholic Charities, the Madison School District, Rogers Behavioral Health, Anesis Therapy, and I'm forgetting there's another big one too. So if you want to listen in, everybody's welcome. There's a lot of great information that gets shared. And then June 4th, 1 to 2, we'll be talking about grief and loss during COVID-19. So those are available to people. They're open and anybody can stop in and check them out. So now I'm done.
Oh, Anna, thank you for the great presentation. We've already got some questions. Larry, you're up first.
Thanks, Anna. I guess most of my questions revolve around how you work with the homeless community here in Madison. So, for example, do you train volunteers at the Beacon? I would think that would be an important, maybe they get trained by other people, but you guys seem like you would have one up there. And maybe I'm misinterpreting. We often talk about the homeless as having a lot of mental disease. So is that a characterization correct, or is it just what people think when they think about the homeless community? And two other questions. I hate to add all these up. Do you see a big correlation between mental illness and drug and alcohol abuse? And lastly, what kind of reimbursements do you get from like the insurance industry for the work that you do? It seems like a very important health issue that should be dealt with by insurance as well.
Sure. So the Beacon does, I believe, do their own training. We have not done any trainings for the Beacon not in this past year that I recall. I know we've hosted last summer, we did host an event with Karen Andro from First United Methodist Church, just around raising awareness of the intersection of homelessness and mental illness. And there was a video that was produced that kind of highlighted the work that Karen was doing, as well as Street Pulse and then Unique Madison Social Club. So it's certainly something that is very important, because going back to your other question, there is a high rate of mental illness within our homeless population, which is why we see a lot of folks that struggle with maintaining housing, is because they're not getting adequate support to treat their mental health conditions, or even support in how do you manage housing and other things that go along with that. So yes, it's definitely an issue. I think also in our homeless population, there's a high rate of people that are living with trauma or who have had traumatic experiences in their past. That comes out quite a bit when you talk with folks sharing their stories. So definitely. Also, the intersection of substance use disorders and mental illness is a big issue. And we're really trying to, at the county level, figure out how we can collaborate more, because there historically has been a trend to silo the two disorders. And, you know, I think some of that goes with stigma on both ends. But we really need to bring that together, because we know there's a high rate of comorbidity. I think, you know, you look at Wisconsin in general, and I think we like to think of ourselves as being the best. We don't have the best behavioral health system. And so we also, what we see is we have a very high rate of substance use disorders, diagnosed or undiagnosed, whether that's, you know, looking at alcohol abuse or other drugs. So definitely there is a correlation. We're trying to improve that communication so that when people seek substance use disorder treatment, they can also access mental health treatment because they're almost always tied together. Not always, but there's a very high rate of comorbidity. As far as insurance, we don't receive any money from insurance companies. All of our revenue is raised through individual donors or through our events, and then we have several grants. We do grants with different organizations, or like I said, this county contract, which has really been helpful for us. So we're just trying to continue to diversify where we can get our revenue from, because what I didn't mention is all of our services are free for the people who participate. So that's why we do the fundraising, so people don't have to pay to attend our groups, our classes, our presentations.
Other questions for Anna? Well, I have a question. When have you seen with COVID-19, I mean, I think this is a very stressful time on a lot of people. What is the correlate? I mean, are we seeing a rise in sort of diagnosed mental health issues? I mean, what is the correlation between mental health and the impacts from COVID-19?
Well, based on the call that we had last week, the different providers, whether it's UW, Rogers Behavioral Health, Tellurian, they are reporting that there's an increased number of people reaching out and doing intakes. So we are seeing that. I would say looking at some of the data county-wise around suicide attempts and completions, those numbers are higher than what they were last year. And so we're also seeing that. We're also definitely seeing an uptick in overdoses. Some of that information is a little bit harder to get just for confidentiality, but we're seeing that as well. I think what I believe will happen is right now folks are still a bit in that first phase of crisis. So we're really trying to build our capacity and maintain the capacity that we have now for our behavioral health community, because we know the need is going to increase as we experience a longer period of people experiencing unemployment, food insecurity, housing insecurity. I think we're going to start seeing a bigger impact with our children and youth because of the disruption that they're experiencing, not only in their school setting, but also what might be going on at their home because of COVID-19. So really, we're just working to make sure we maintain the systems that we have in place, but also start advocating for the fact that we're going to need more down the road. Like, I think the county has done a great job and the city has done a great job in moving towards getting those first basic needs met for community members. But I do think behavioral health support is going to have to be within like the second wave of how we're supporting people.
Other questions? I'm sorry?
Oh, I was just also going to say we also are seeing an uptick in calls around domestic violence. And in particular, we're seeing that for families that have children and adults living with disabilities. There has been more calls on that just because people are at home and a lot of things have been taken away, and it's been really hard on the disability community in particular.
Larry.
One last thing. What would you recommend is the best training for community leaders on this issue? Because I really think that beyond the first responders and police, the community leaders need to have better understanding of how to deal with mental illness. So is it one of your programs or some other program?
Well, I would definitely encourage people, community leaders, to sign up for our family and friends seminar. Like I said, it's 2 to 4 hours. It's a great overview around mental illness and then also how to support folks. I would also say we have some programs that are specific to Namidane County. So if the community leaders ever want to bring us in, we have a very nice presentation that we give around verbal de-escalation. And so that really gives an overview around mental health, but also walks you through some things you should do for verbal de-escalation and a little bit of role playing. I hate to say it because I'm not a big role player, but there's a component of that, and it can be helpful to practice. I would also say we have our in our own voice presentation, which we've found to be really popular and very helpful because it's actually someone giving information, but then sharing their own story of living with a mental illness. And I definitely, as we roll out more CIPs, crisis intervention partner training, we can update people, but I think that would be something that's really important for our community leaders to be involved with as well. I mean, like with the numbers, we know so many people, we all know somebody that's been impacted. So I really think it is helpful for us all to be knowledgeable about mental illness and what to do to better support individuals living with a mental illness.
Question I wanted to tie in with, we had a presentation from the mental health officers with MPD and Journey Mental Health.
Yep.
I don't know, time is going at a weird rate right now. So probably, it could have been 3 months ago, could have been 6 months ago. But the first responders to many of these sort of crisis situations oftentimes are police, and potentially, you know, that's not the best group to be dealing with. And they readily admit that. You know, our models, and I know Dane County is on the early stages of looking at how to improve that model, but are there other models in other cities and other countries where there is sort of teams that can come and work through those crisis situations from the get-go?
Yeah, and that's, you know, that was something that we were really discussing in the Behavioral Health Subcommittee of the Criminal Justice Council. We were looking at other models. That is something that I'm advocating for strongly as the Executive Director of Namidane County. We had someone come from Cahoots, which is a program out in Oregon. I forget, what do we call it when it's the state? Oregon. No, Oregon.
One or the other. Yeah.
I know there's Oregon. So they, Tim came and spoke with us, and that's exactly what it is. It's a mobile crisis response team. They work out of vans. It's typically a social worker, an EMT person, and then a peer, someone with lived experience. And so they can be called when something happens. They go through dispatch, and dispatch can make that call. Do I need to send this out to law enforcement, or can I send it to Cahoots? They had, gosh, maybe 70,000 calls last year, and only, I think, 1.5% of those resulted in having to call back up to law enforcement. So they were able to de-escalate these situations and get folks the support that they needed. So that would be responding to things like disorderly conduct, right? If you have somebody yelling at the top of their lungs in a public place, instead of calling law enforcement out, they bring in Cahoots. Cahoots comes in, they can de-escalate, they can actually transport people to places. So if they need to go to detox, they can take them to detox, or they can stay, or if they need to get medical care. So that is a model that we had been talking about, which it could be really promising, which I would love to see, because right now it falls into the hands of law enforcement. And even with training, the law enforcement model is not set up to support someone who's having a mental health crisis.
Well, you're right. I think it brings up one of the first advocacy points you were discussing, the criminalization of many of these issues as well, just by the nature of the people that are dealing with them. So let us know how we can help with that. I don't know where that project is, but we were talking to Casey at the county and a few others about how to move that forward. It's a very interesting program. I highly recommend it. It's in, I think it's Salem, Oregon.
It could be. It's if you Google Cahoots, CAHOOTS, it'll come up. And there's other models as well. That was just one that had some coverage, and they were really out there trying to get their work out there. So
we had a statement from Lynn Wood. I don't know if Lynn just wants to say it herself, or I could say it out loud. Lynn? I don't know if she's on.
I'm on, sorry. Yes, I just wanted to say thank you so much. This is really great info. I have been looking for, to kind of put together some resources for our current Leadership Greater Madison class and alum. And I know I always think of NAMI, but for some reason today it just kind of clicked for me, like you and several other of the groups that you mentioned. I guess I wanted to give a heads up that I'm going to reach out, because I think our leaders who are in this training program and are really kind of on the front lines and doing a lot of cool things in the community would really benefit from this. So thank you so much, and I'll be in touch.
Great, you're welcome. And I would really encourage people to go to our website. We have a whole page focused on resources around COVID-19, and it's a really wide range of online support, housing support, food support, providers. So there's a lot there. So if you're looking for some different ideas, check it out.
We got a couple more minutes here. Any other questions for Anna from the group? No? Well, I've got one question then. I'll just keep asking questions. One more. I watched a very interesting documentary on PBS called Bedlam. Have you seen it? Is it to me, it seemed like a seminal piece on many of the issues, and something I think many more people in the community should view. What are your thoughts?
Yes, actually, it's interesting you mentioned it. We had a viewing set up with Journey Mental Health. We purchased rights to the movie, so we're working on how to get that online. But I would really encourage people to check it out. It'll probably come up at the end of June is when we were going to be doing the viewing at Journey Mental Health. But yes, I would definitely have people check it out. I mean, I think what we're seeing, and this is another issue, is really talking about what capacity we have in emergency rooms, because we know the system that we have right now is not working for people. When people are taken to emergency rooms, it can be very traumatic. Folks have to sit for a long time. And really what we see across the nation is, because of some of the rules that are in place, that it's easier for law enforcement to take somebody to the jail than it is to get them admitted into inpatient emergency care if someone's having a mental health crisis. And so that is another big thing that we're talking about. And Bedlam really highlights that. I think something else, just going back to the criminalization piece, is in our juvenile correctional system, upwards 70 to 80% of the youth that are in that system screen for having a mental health diagnosis. Numbers are, it kind of ranges, but maybe like 40% for adults, although I question that number. So it's really looking at how can we make sure that we defer and deflect people from the criminal justice system into quality care, ideally in the community long-term, but quality care, quality inpatient care if necessary. And so yes, Bedlam, very much so. I'll keep you posted when we do that viewing, because I do think it's a must watch.
Yeah, please let us know how we can get that information out. I was struck by it myself. It was a very interesting piece with the history of what's happened with the deinstitutionalization and what has happened in America and the criminalization parts, and particularly our hospitals. And it's very important viewing. So one more chance. Any last questions for Anna before we head off today?
I have a question that brought up a question for me. Anna, we talked about the history of deinstitutionalization and supporting people in the community, but what is the capacity currently in Dane County or resources for people who do need a place to stay, crisis? Is it a hospital setting? Is it a jail setting? Where's Mendota Mental Health in all of this? Can you speak to that?
Yeah, it's really a complex situation. So what I would say is, at this point, our capacity is not meeting the needs for inpatient emergency care. And there's a couple of different things that kind of take place. First of all, inpatient emergency care is extremely expensive. And so hospitals don't recoup the costs for that. So that makes it not beneficial for them to admit people inpatient. And so we're trying to increase our capacity with Willow Creek or Miramount Behavioral Health. But again, that's going to be a private for-profit place. So that's a challenge we have. Inpatient care is not profitable. The other challenge we have is that because of state statutes, if somebody needs to do an emergency detention or an ED or like a Chapter 51, by law enforcement cannot take them to Mendota Mental Health Institute. By law, they need to transport them to Winnebago, which is 4 hours away. So that's another barrier for people, and that puts law enforcement in a bad position because you have to make that call. Is it better to take someone to the county jail and have them stay in the community close to their family and perhaps be able to step into emergency care at one of our local hospitals, or do I drive them up to Winnebago and be on there for 10 hours with someone and pull that person out of the community? Another issue that's difficult is that our Chapter 51 law says that an emergency detention can only be initiated by law enforcement, which again, I understand the foundation was that people wanted to make it difficult to do something like a Chapter 51, but now what we've done is we've really put law enforcement into a mental health crisis, and I don't necessarily think that that's beneficial for the folks involved. But yes, we definitely need more options for inpatient acute care in Dane County. That's something, and that's across the state. So it's not, but definitely Dane County needs that, and that's something that we're working with other providers to try to address. And I think that's another thing. Outside of the mobile crisis response team, we're also talking about a crisis restoration center, which is something that would be akin to that. I think the biggest barrier continues to be the financial cost, which would be upwards of, $3-4 million to get something like that started. But I think it's a direction that folks are looking to go to.
Okay, thank you.
Mm-hmm, definitely.
Anything? All right, we're coming. So I want to say a huge thank you to Anna for this very enlightening and important presentation. We really want to thank you for giving us this information, but also your continued community leadership in this important event for not only downtown, but for our whole community. So a huge thank you to Anna for this presentation. And thank you to all of you for joining us again for our umpteenth virtual quality of life meeting. We'll be in touch soon with information on the next set of meetings, but you can always go to our website for all of the other events. We're running 10 to 15 virtual events a week. So join us for any and all. I hope you all have a great rest of the day, and thank you all for joining us.
Thank you.
Thank you, guys.
Bye.